I'm Taylor Wilson. I'm a certified athletic trainer with St. Francis Sports Medicine. Today we're going to talk about blisters, cuts, scrapes, and how parents and athletes and adults and kids can learn how to cover those and keep them protected so they don't get worse when you're being active. We're going to talk about blister care first and go over the supplies that you'll need. First, you'd like to get second squares. You can find that at REI or on Amazon. You want to get some basic triple antibiotics. Sometimes people call it Neosporin. You can buy that. A Band-Aid that's big enough to cover the blister, and then you want one of either of these. Coverall you can find online or Tegaderm film. Okay, we're going to walk you through the process of either how to cover a blister that you already have, or you can also do it for prevention to make sure that you don't get blisters. So you're going to start with some triple antibiotic. You're going to place it on your blister or where you think you might get one. This helps with reducing friction, so you're just going to put it right back there where the shoe might normally rub. Next, you're going to take your second skin. It has plastic on each side, so you want to take the plastic piece off. You're going to place it over your triple antibiotic. Next, you want to put your Band-Aid that you picked the correct size for. Make sure that the pad covers the injured area. Put that on the back of the heel. Pull it a little bit tight so it doesn't bubble up. And then your last piece is your Coverall or your Tegaderm. You want to give it a nice little tug, and you're going to put it right over the Band-Aid. Smooth it down as best as you can. That's how you prevent or take care of your blisters. This time we're going to cover scrapes and cuts, how you want to cover them, and then a couple supplies that you don't want to use. Some basic supplies that you want to have on hand, in your car preferably. Some gloves, non-latex, a basic skin cleanser, or warm soap and water works as well. Triple antibiotic or Neosporin. A non-adherent tape, it only sticks to itself, not skin. And a non-adherent pad. The two supplies you don't want to use if possible are hydrogen peroxide. It can be very painful and a little bit harmful to the skin. In addition to gauze, you do not want to use a gauze that is woven. Okay, so what you want to do first with any cuts or scrapes is you're going to want to clean it. And so you'll just pour that onto the wound, clean it up a little bit. Next, you're going to put your antibiotic onto your non-adherent pad. They should feel a little plasticky almost. That's so it doesn't stick to the wound. So you'll put it on your pad, put it directly onto the wound, and then you're going to take your non-adherent wrap and wrap it around your non-adherent pad. This wrap is sweat proof, so you can play with it on. It won't come off and it won't attach to your wound. And rub the end down really good so it sticks just to itself. And that's it. So here are some guidelines to look for. If your wound continues to bleed, if it turns red, gets swollen, feels hot, or has pus coming out of it, you might want to seek some additional care. So some things you can do are call our HURT line for the St. Francis Sports Medicine at 675-HURT. You can visit one of our AFC Bon Secours Urgent Care or our Bon Secours Express Care downtown.